Fritz. I am a licensed acupuncturist, and I have a wellness center called Way Wellness Center in the Fox Chapel area of Pittsburgh, Pennsylvania. Today we're going to be talking about a general introduction to acupuncture and Chinese medicine. So acupuncture is a fundamental aspect of Chinese medicine. It originated in China, although it is practiced all over the world. And there's different systems of acupuncture. There's Japanese style of acupuncture. It is based on a 5,000-year history of practice, so it is based on an ancient medicine. But it's only been practiced in the West for approximately the last 50 years. So it's often considered to be a new practice, an alternative therapy, which is fine, but it is an ancient medicine that is new in the West, but not new historically. Our definition of acupuncture is going to be that it's the main form of treatment in traditional Chinese medicine, or TCM. It involves the use of sharp, sterile, disposable hair-thin needles that are inserted in the body at very specific points, known as acupoints. This process is believed to adjust and alter the body's energy flow, or qi. What is acupuncture used for? This is a very common question that I get when anyone calls our center or maybe stops in, or somebody who I know socially will be like, well, what do you do? What do you treat? What does acupuncture actually do? My response is often that it's a whole system of medicine, so it can treat any health or medical or mental emotional issue that you have. So we'll often ask you what your chief complaint is, why you're coming to the clinic, and then we ask you a lot of background information to try and get you the best treatment possible. The World Health Organization did some studies in the 90s, and it defined acupuncture as being useful for over 40 medical issues. These include allergies, respiratory conditions. This can be things like cold symptoms, and also longer-term issues such as asthma, gastrointestinal disorders. So anyone who comes in with a diagnosis of IBS or acid reflux, potentially someone who doesn't have a Western diagnosis but has gastrointestinal discomfort would benefit from acupuncture. Gynecological problems, this can be any kind of menstrual irregularity that a woman may be dealing with. Fertility issues is something that we will often treat. Disorders of the eyes, nose, and throat, childhood illnesses. We have a very strong pediatric acupuncture practice. Children will often benefit quite quickly from acupuncture treatments. Chronic pain, that is something that we would treat very, very commonly. It's also, acupuncture has been used in treatment of alcoholism and substance abuse and other addictive type of behaviors. It's used to supplement invasive Western treatments like chemotherapy and surgery, potentially like post-surgery. And it's definitely limited in treating conditions or traumas that require surgery or emergency care, such as broken bones. So the education of an acupuncturist is another question that a lot of people have. Acupuncturists go to a four-year master's degree program from an accredited school. Different licensure will have different titles, but mine is a Master of Acupuncture and Oriental Medicine, or MAOM. Most acupuncturists are also licensed herbalists in Chinese herbs, and then they're licensed acupuncturists. An education will also be certified by the National Commission of Acupuncture and Oriental Medicine by passing national board exams. The national board exams will include exams on Chinese medicine, acupuncture point location, Western physiology, Chinese herbs, and there will also be a clean needle technique class. And then in addition, acupuncturists are licensed by the state medical board. The origins of acupuncture There's a lot of different histories that you can read about. Because a lot of it was an oral tradition originally, there's some conflicting dates with when things really started. But it started as a regional or folk medicine that was taught to people orally and didn't have a written tradition until more modern times. The Yellow Emperor's Classic of Internal Medicine was written 2,500 years ago, and it's really the first book of Chinese medicine and acupuncture. There's now numerous texts available. Many of them are translated into English. The practice of acupuncture in Chinese medicine was standardized in China during the Cultural Revolution, which was between 1966 and 1976, and it's now an established part of all hospitals in China. And really we're seeing a lot more acupuncture departments or acupuncturists working in Western hospitals as well. And I believe that will continue to grow. The philosophy behind acupuncture, and there is a philosophy, we don't usually talk about this a lot when we're caring for patients, but it's basically the philosophy of Taoism. It's a philosophy, not a religion. It originates in the teaching of Lao Tzu and Chuang-Tzu. Basically, it teaches that individuals should pursue a path of discovery and live in harmony with the universe. To break that up a little bit more, we look at Taoism, we'll look at the body as a micro version of the universe. Our goal to maintain health is to have harmony inside and out, and live in accord with the external world, or live in harmony with your environment. Have a balanced state of health, and internal and external balance. So we want to sleep when we need to, eat when we need to, living in harmony. The idea of living in harmony with our environment will create less stress and better health overall. And that also is the same case with our bodies. We nourish our bodies in the correct way, then we will have overall health and less issues. The yin and yang, or yin-yang symbol right here, is a principal concept that is an overview of everything that we do in Chinese medicine. There's a whole class on yin and yang and how it affects how we look at it in Chinese medicine and how it affects our health. But basically, the yin and yang are complementary, interdependent opposites, and neither can exist without the other. They can transform into the other, and each contains a seed of the other within it. Yin and yang consume and support each other, and each aspect of yin and yang can be further subdivided into yin and yang aspects. So here we see the Tai Chi, with the black being the yin aspect, with a little bit of the yang within it, the light dot, and then the lighter part being the yang with the yin. And these are kind of always moving, interdependent. And when there's a balance of the yin and yang, we have harmony with the universe, we have health and balance. The yin and yang were really first written about in the Book of Changes, or the I Ching, which is written in 700 BC. There's a lot of different aspects. In the West, we often will think of them as being opposites of yin and yang. Yin being things like female, passive, dark or shaded, nighttime, and yang being more male, active, bright, and day. Within the yin and yang system, because they're interdependent, there is not a value associated with either of these. So a Western concept may be that one is better than the other, and what Chinese medicine and the Taoist philosophy really teaches us is that balance between the two are best. So the yin and yang in the body, this is how Acupuncturists will look at yin and yang with a person who's coming in. So the yin and yang have paired organ systems. We'll use the same terms as Western medicine does as far as we talk about the lungs, the kidneys, the liver, the gallbladder, but within that it's like the liver system, the kidney system, and it's a little bit different as far as the functions and the meanings behind those organ systems. Each yin and yang paired organ system will have an organ and meridian, or a line of energy or chi that runs into the body and into that particular organ. And then the smooth flow of chi in the organs and meridians is necessary for health. So it's really what we're looking for, is to have a fully functioning organ system, and that means that smooth flow of chi and blood in the meridians, into the organs, and then they're all interconnected. We can see the yin and yang organ systems in this diagram. It has what we call a 24-hour Chinese clock. And so this shows how chi and blood move strongest into certain organs during a 2-hour block of time over a 24-hour period. This can be diagnostic. For instance, if somebody always wakes up between 1 and 3 a.m., highly agitated and stressed and cannot get back into sleep until after 3 a.m., then we would look to their liver system being out of balance and perhaps stagnant. If someone always complains of digestive problems in the early morning, between 9 and 11 or 7 and 9 a.m. even, then we would look at the spleen and stomach system and see if that might have a bit of an imbalance. So it's not necessarily diagnostic, but it can be helpful in finding a cause of an imbalance. And we have here the yin and yang paired organ systems. So you see lung and large intestine, spleen and stomach, heart, small intestine, kidney and urinary bladder, pericardium and triple heater or sanjiao, liver and gallbladder. And they're all paired there with the yin on the right and the yang on the left. So how do we diagnose what is going on with Chinese medicine? In addition to a health history questionnaire that we have everybody fill out, that gives us, again, your medical history, any kind of Western diagnoses you may have, we take that into account. But the primary means of diagnosing your imbalance in terms of Chinese medicine is going to be taking your pulse and looking at your tongue. The pulse and tongue will reflect the health and balance of the internal organs and the overall state of harmony or disharmony. It also gives us an idea of a pattern of disharmony that'll create a diagnosis. Disharmonies in Chinese medicine are considered to be caused by primarily diet, lifestyle, and then trauma. And then a diagnosis in Chinese medicine is fluid. So this is an interesting aspect that most people can appreciate. If you're coming from a Western view of diagnoses, it's usually fairly static. You are tested for diabetes. It's a positive test. You have diabetes. You are a diabetic, from then on. Diagnosis in Chinese medicine is more fluid. So based on how you come in, we take your pulse, look at your tongue. We will come up with a diagnosis as far as the disharmony that is present at that time. And then, it should change over time as you get treatments. We should hope to see a change with your pulse, a change with your tongue. As you do acupuncture, as you take herbs, if you're compliant then with also diet and lifestyle changes, it'll change even faster. Okay, so the pulse positions, this is just a picture of the pulse positions and how we would take it in a treatment. And so when we check your pulse, we're not necessarily taking your blood pressure or anything like that. We're not even really checking the pulse rate, although we would make a note if it was a little bit fast or slow. So with the pulse, we're looking at the quality and nature of the pulse. There's various descriptions that aid in a diagnosis.